You get a set up. Thanks so very much. Before I go to my slide presentation, I would just like to introduce myself. For those that do not know me, I do know some of the individuals on the call. I see a church member, as I said earlier, if you heard that, and I appreciate you being on the call. And I see, of course, Alliance staff and other members in the community as well. I am currently, I've been in my position now for 14 months as the community education specialist with Alliance, and I've been with Alliance for 9 years. So I'm really pleased to have this opportunity. And prior to coming to Alliance, I have worked with various service providers in the field of developmental disability. So I work with children and adults who have intellectual developmental disabilities, and I've had that as my life work for 35 years. So that was pretty amazing. So I just asked that for this session, if we can have it, pretty interactive, because I don't like to talk a lot, but, as a trainer, you have, that call, you actually have to do most of the talking. But I do encourage your participation. You can put any comments in the chat box, and Becky will, call those out to me if there's something I need to bring attention to. And also, I like to say that at the end of the session, if you would like to receive a certificate and the PowerPoint, please put your name and your email address in the chat, and I will try my best to get that out to you by the end of the week. Sounds good? All right. Okay, so at this point, and you would think my my slide has actually left me. Try this again. Get there. All right, here we go. Can everybody see my screen?
Yeah.
Hello? Okay, thank you so much.
Yes.
Okay, so our session today is entitled National Red Day for Women's Heart Health. Okay, and you're probably wondering, what is all the fuss about? Well, before I get into all of that, I do have to do a quick Alliance Health infomercial. And for those that do not know about Alliance Health, we are the local management entity in the managed care organization. We're currently serving Cumberland, Durham, Johnston, Mecklenburg, Orange, and Wake counties. So we actually service 6 counties now within the state of North Carolina. And it is our responsibility to authorize, pay, and manage Medicaid, state, and local funded services. So if anyone is in need of any type of behavioral health service, they can contact Alliance Health 24 hours, 7 days a week, 365 days a year to obtain information and to access behavioral health care services. This slide indicates our 2020 annual report. So if you would like to actually receive a copy of this annual report, all you have to do is just take your cell phone and put it up to our QR code, and you can scan our actual annual report. And our annual report actually highlights our work across all our departments as we have engaged with our communities to build stronger and healthier individuals. So it's a lot of good information in our annual report. Okay, so if you're wondering, well, how can I access Alliance? How do I contact Alliance Health? And this is our 1-800 number for you to see on the screen. Again, you can contact us anytime. Within our community health and well-being team where I work, it is our function where we work together with our communities to connect people to provide social and community supports that will enhance recovery and their overall well-being. We are very big on recovery here at Alliance. So it's our team's focus to connect with our communities and provide training and educational opportunities related to physical health and mental health topics, as well as participate in various community outreach efforts. We are truly the boots on the ground for Alliance Health. And since we've been in this pandemic, we have definitely been doing great work related to COVID-19, getting the word out about free crisis counseling services that is confidential. It's available 24 hours, 7 days a week. And you will talk to a live person and they will give you information pertaining to your personal situation. So people have really been suffering and they need some supports to build resilience in regards to this particular pandemic. So you see the number on the screen and it's available again, 24 hours, 7 days a week. And you can speak with a live person in regards to that. Also in regards to the scoop of managing stress, it's important that, you know, we really pay attention to how we manage stress. Stress is really a major event in a lot of our lives, and we have to pay attention to that. So it's important that we stay connected to our family and friends. So that is the symbolism of the S with this acronym. So we want to build those connections. We want to be involved and have those contacts. So it's important that we show compassion for ourselves and for others, so that way we can also decrease our stress. And in addition, it's important that we need to observe our use of our substances because, you know, we don't want to overindulge in substances that are not healthy for our bodies. And also the second O indicates that it's okay to ask for help. Yes, people are struggling. It's okay to share that I need help. I need to get support. I need to talk to someone. So it's important to reach out when that need arises. And finally, the P indicates physical activity is important. We all know this, right? Exercise and it boosts our mood and lowers our anxiety. It's good for our body. So we really need to act upon managing our stress. So that's my infomercial. So we're going to get right into it, what we will cover for this session. And it's indicated, we're going to talk about what is the hype all about, okay? We're also going to talk about what you can do to support the cause. We're going to define and identify the different types of cardiovascular disease and talk about the risk factors of a heart attack and stroke, and then complete a quick, silent assessment that will be very personal to yourself on whether or not you have any of these risk factors. And then we're going to talk about how we can bounce back to living well. And finally, at the end, I like to have an open mic discussion. You know, if you like to share a related story, ask questions, or offer any additional comments, that will be welcome. So, National Wear Red Day for Women's Heart Health is going to be observed February the 4th, this coming Friday. I have on my red today. So you probably ask, well, what is the hype all about? Well, it's really important that this campaign addresses the awareness about cardiovascular disease and helps save lives. So many people have lost their lives to this dreadful health crisis. Why is it important? Well, it's important because, again, one life is one too many to lose. So this campaign has been in existence since 2003, and the purpose is to eradicate heart disease and stroke. So in essence, National Wear Red Day is a reminder for women everywhere to make some commitments to engage in healthy behaviors, make some lifestyle changes, because heart disease has been the #1 killer for Americans, and that is quite astonishing. And let me repeat, heart disease is the #1 killer for Americans. Do you all know that?
Yes.
You
Yes.
did. Okay. All right. So in support of this day, every year, supporters wear their red dresses, you know, they put on their red shoes, the red blouses, this accessories, and they stand together, as the picture is indicated here, and encourage each other to take preventive actions for the sake of their own heart health, right? So it's important, again, National Wear Red Day for Women's Heart Health is truly a great campaign, and we all really need to get on board and participate. Okay, so if you, and I'd just like to ask, if you have on red today, I'd like to see you in the gallery. If you can turn your cameras on for a moment, and let's just see who actually is on with red on. Anyone other than me?
Uh-oh.
I don't see anyone on with red.
I will on Friday.
Okay, Charlene and Marvis. Okay, don't be shy. Anyone else that I'll go back through.
I have read something, I think.
Okay. All
Friday,
right.
Friday. I actually have it in my calendar on Thursday to remind myself to wear red on Friday.
Awesome. That's beautiful. Friday is truly the day. So don't forget, mark your calendars if you have to do so. Okay. So February is also known as American Heart Month. The American Heart Association has really put out this campaign to educate and fund research, to put on different health initiatives in support of women. So you probably ask, well, what can I do, you know, for this cause? Well, you can always give money, right? You can always give a donation to support the cause, to support the research efforts. And you can also spread the word. If you're not able to give a financial contribution, you can also spread the word on social media, encourage others to wear red and give. And finally, you can also join conversations with the hashtags at the top here, as you see. Hashtag Wear Red Day, hashtag Go Red for Women, hashtag Heart Month. So many women have provided their personal stories about their health scares and how they endure the courage to live healthier lives. So this is a big deal. Now, I have some alarming statistics, okay? I don't want to scare anybody, but it's definitely worth looking at and just taking a moment to say, what can I do? So as you see, 50% of women may die within 5 years of having a heart attack. Based on the research I've done, 33% of women do not engage in sports or physical activity. So that is not a good sign. So we need to get active. 43 million women currently have some type of heart disease, and there are so many different types of heart disease conditions that are out there. But for this session, we're only going to concentrate on heart attack and stroke. Okay. And also it's indicated that half of sudden cardiac arrest victims are under age 65. And usually it's been reported that they're in their 40s and 50s based on that particular statistic. Also found that, now this was quite alarming, 659,000 Americans die annually from heart disease. 659,000. Isn't that quite alarming to people? I mean, is that not a wake-up call?
It's a lot of people.
Yes.
It is.
Oh my gosh. You know, when I saw that number, I mean, die annually. I mean, we're not just talking, you know, that's just been a cumulative number, but annually. I mean, that is reoccurring. So we all have to take action. Okay. So this is definitely a big concern. Heart disease kills more women than any or all the cancers combined. Now, that was astonishing for me to see that. All the cancers combined. Also, it was noted that stress poses a greater risk on heart disease in women, because a lot of times women don't view it as heart disease. They may think, oh, it may be indigestion. You probably heard that story before. Or I'm just having a stressful moment. Or, I'm overworked. I have too many demands in my day-to-day life. So, so we kind of brush it off, so to speak. Another stat that was given to me is that diabetes in women is a greater risk factor for heart disease than in men. Okay, so if women that are diabetic, they're at greater risk of developing heart disease than men. So that too was hard to hear. And I just want to also indicate that going back to the number of individuals that die each year, it was reported that 1 in every 4 deaths result from heart disease. 1 in every 4 deaths. And that means a person dies every 36 seconds from heart disease in the United States. So I see there's some things in the chat. I don't know if there's something for me to acknowledge or not.
I'm manning it. You're good.
Okay. So, but with all this bad news, there is some good news. There's a light at the end of the tunnel, believe it or not, right? There's good news. The good news is that 80% of heart disease is preventable. So that is like a sign of relief. That is awesome to hear. And the ways that that can be prevented is through regular exercise, avoid using tobacco and maintaining a healthy diet. And we're going to talk about that, a bit later. Okay. If anyone have any questions or comments, you can chime right on in. So you probably asked, what is cardiovascular disease? All right. Well, you probably, the term heart disease, cardiovascular disease is all, pretty much used interchangeable. So it's any heart disease, any heart conditions that basically affects the blood vessels and the structure of the heart and add blood clots to the heart. Okay. So that's pretty much, those are the culprits that result in heart disease. And there are 5 common types of heart disease that we're going to talk about a little bit today. Heart attack, and everybody know pretty much about the heart attack, right? That occurs when there's a blockage in the heart. So if the heart is not getting that blood flow, then a heart attack could result. Okay. So the stroke is another condition we know about. So basically that's damage to the brain. The blood flow is not going to the brain like it should. So that causes the stroke. Arrhythmia, that is abnormal or irregular heartbeat. Maybe the heart is beating too fast or too slow, or it's just an irregular beat or tempo. All right. And we also have cardiac arrest. That's when the heart actually stops beating. That's heart failure. There's loss of heart function, there's loss of breathing, and loss of consciousness. So that is major. That is definitely life-threatening. All of these conditions are life-threatening. And then, of course, finally, we have heart valve disease. And that could affect any one of the 4 valves in the heart, and it presents with a heart attack, and as well as there's some blood pressure issues. Okay, so we're talking about, basically heart disease 101, right? That's what I call it. So knowing this heart attack signs and symptoms, I'm sure you've seen this information before. Probably most of you have taken a adult CPR first aid class, right?
Yes.
Hello? Yeah, okay.
Yes.
Y'all can talk back. Okay, awesome. So
I was an EMT one time too.
okay, and who was that speaking? I'm sorry.
Linda Lazanecki.
Okay, Miss Linda. Okay, well, you can look, Linda, you can tell us all about this, right?
Yeah, I've got a personal experience I'd like to share too. So
Oh, awesome. Thank you, Linda. We'll be glad to hear about it at the end. That'd be great.
Okay.
So Yeah, so knowing the heart attack signs and symptoms, and the common ones, as we probably hear all the time, the chest pain, the shortness of the breath, right? We hear about those all the time. We hear about discomfort in the arms, as the slide is indicating, the back or the neck or jaw, the shoulder, and there's that sweating, profuse sweating that could occur. Now with women, women pretty much have what we call atypical cardiac symptoms, where we're not there. Things are happening a little differently with our bodies when it comes to heart attack signs. So we may dismiss this a lot of times, we may not feel right within our bodies. We may get dizzy or feel nauseated or just feel like, wow, I don't feel like myself. This is unusual. There's a heaviness feeling in the chest, and the chest pain may not just stay in the chest area. It may just move to the arms, either arm, okay? There's some difficulty, of course, breathing. And even it's been said that there may be some type of barking cough that could be associated with the symptoms that women may have. And then there's some signs that could be some type of impending doom. Well, you just feel like, I'm just giving up. I just don't feel like it's worth me doing anything. So when all these things are happening, what do you think should happen? What should be done? If these signs and symptoms are occurring and you happen to be someone nearby, what should you do?
Call 911.
Okay. Call 911 is the second thing. And what's the first thing you should do? If the person is, really in severe state and they're not conscious.
Well, you start CPR. If they're not,
Okay,
you
right.
You check for a pulse to see if they have a pulse.
Right. So yeah, so definitely, if the person's unconscious and, this is a severe state, you definitely will you need to start CPR, and you definitely need to call 911 for sure. Absolutely. So with that, I just wanted to give this stat about, if your heart actually stops beating by 9 minutes, severe and permanent brain damage is likely. Right? Linda, you know this, right? It's been said that after 10 minutes, the chances of survival are very low. So it's really critical. Once that heart stops beating, it's very slim, if that person does not get that prompt medical treatment to be revived. Okay. So we want to go ahead and talk about the signs and symptoms of a stroke, the 5 common ones, at least. We've heard about, the numbness in the face and then the one side of the body, there's some confusion with the speech. There's problems with the arms, that one arm may be hanging or dangling longer than the other. And then, of course, time is of essence. That acronym FAST is very important when it comes to a stroke. Person is unsteady on their feet. They need to, lie down or sit down. They don't need to try to be walking. You see that they may have problems with their vision, and that could be a problem. So when we talk about seeking medical attention, we need to act fast. So that's an acronym to remember, associate that with the stroke, with the medical treatment. The face is representing of the F, and the A, the arm, speech, that slurred speech, and then of course, time is of essence. Okay. So when we talk about heart disease risk factors that can't be controlled, I mean, there are some, culprits there that we just cannot do anything about. If you have a family history of angina or that chest pain, or you have a family history of heart attack, I mean, unfortunately, it may happen to you as well. So that's because it's genetic. if there is some increasing age as we get older, our chances of having heart disease definitely increase if we have an unhealthy lifestyle. Okay, that's a known fact. And then of course it's indicated that men are more prone to have more heart attacks than women, and they actually start at least 10 years earlier than women with having heart attacks. Because back in the day, people used to say, oh, heart disease is just only for men. Well, that's a myth. That is not the case. That's not the case any longer. Women have just as many heart attacks as men. Now, we do know that African Americans are at higher risk of heart disease than any other ethnic group around. Okay. So there are some heart disease risk factors that can be controlled. So this is the good news. So this list is a lot longer than the first list. So that means there's some things we can do to reverse this condition. If you may have any health-related issues, chronic health conditions such as hypertension, diabetes, high cholesterol, as the list goes on. Of course, if we look at this and you say, wow, this is a lot to do. Okay, but knowing your numbers is very important. Knowing your cholesterol numbers, and your cholesterol basically is in two parts, the as we call it, the good cholesterol versus the bad cholesterol. The good cholesterol is your HDL. Okay, so you can associate the H being, you want that number to be over 60, being high. You want that number to be a little higher, okay? Over 60 is a desirable number that you want for your HDL. And the HDL basically serves as the vacuum for the arteries. So it keeps all that bad cholesterol out of the arteries. Okay, so we want to make sure we have good HDLs, right? That are within a desirable range. As far as your LDL, which is the bad cholesterol, that number should be under 100. So we want that bad cholesterol to be low, under 100. So you take those two numbers and put them together, then you probably get your desired cholesterol level. And you want your desired cholesterol level to be, or that number to be 200 or lower, not higher than 200. But that's desirable that it's under 200 for your cholesterol, your overall cholesterol. Anybody know what their overall cholesterol is? You don't have to share what it is, but you got to know what it is. If you get your lab works and you look at those numbers and, just keep that in mind, what it may be, okay? Hypertension, high blood pressure, you got to check it often, okay? It ranges from highs to lows. I mean, me as a witness, I check my blood pressure a number of times throughout the day. This morning before I left home, I checked my blood pressure. It was super high this morning, because I was kind of a little nervous about this presentation, but before I left, it did, come down. I'm like, why am I nervous? I mean, I don't understand this, but it was normal before I went to bed, but it was a little elevated. Not extremely elevated, but it was a little elevated, and it was more higher than I will, expect for it to have been. So when you talk about diabetes, we're talking about the high blood sugar, that can also be controlled. Ideally, it can be controlled with medications, diet and exercise as well. Okay. So we just want to be aware of what these numbers are in relations to our own individual lives and take heed as to what they are. We got to take action. Unhealthy diet, alcohol consumption, all these risk factors we can control using tobacco or smoking. Okay, so there's a difference there. Negative feelings and having stress and just holding on to stress. We all get stressed, but just holding on to that stress and not doing anything about it. We need to take action. And we also definitely need to be aware of whenever we're feeling depressed, come out of that little slump, come around people, again, managing the stress, getting that scoop done, taking care of you, having time for self-care. When you have that lack of physical activity, that is paramount. That is going to be a major hindrance on how you're feeling, right? So anybody have any tips on how they can control some of these risk factors that you'd like to share with the group?
Well, during your physical, after your physical, I should say, you get your blood panel, and that'll determine your cholesterol and your blood sugar levels, etc. There's medications
Right.
that can be used to control those issues
Right.
that you can't control on your own, whether it's through diet or exercise. And that's a known fact that some folks have higher cholesterol levels, not because they eat French fries and McDonald's every day. It's just because it's a genetic issue. And so there's medications to help folks with that.
Absolutely. That is correct, Linda. Yes. So again, just knowing, your family history is so important, and how you can take control of your own personal lives. So absolutely. Anybody else want to share a comment about how they can have taken control on any of these risk factors? With diet, I will just say that a lot of times now it's been, we hear more and more about plant-based diets, Mediterranean diets, that is much better for us. We kind of need to eliminate meat, definitely the red meat in our diet as much as possible. So all these are, indications of how we can, take some action and make some lifestyle changes for sure. Okay, so we're going to talk about that a little bit more. Anybody have any questions thus far about any of this information that we've shared? I would like to add, though, going back to high blood pressure, and this was, again, pretty alarming statistic. 1 out of 3 persons have high blood pressure. So if you take 3 of us together, at least one of those 3 persons will have a diagnosis of hypertension, right? So that's pretty alarming. So you just, next time you get in a cluster, and you probably, if you feel comfortable asking, someone that you're familiar with, if you're in with your friends, and how many of us have hypertension, and see if that's really a true statistic, okay? So, now, with all this information that I've shared regarding risk factors, I have a quick self-assessment that I would like for you to take and evaluate your own risk factors for heart disease. This is nothing you need to share, nothing you need to say out loud, but it's just giving you an eye-opening activity and how you actually rate. So if you look at these 11 statements, and if you would just take a moment and check the statement if it applies to you. I mean, it's just 11 statements, quick statements that you can read. And we're going to start right now, and I'll just give you a couple of minutes to do that. Okay. And then I'll tell you the end result. So just indicate how many statements apply to you. Okay, did everybody finish?
Yes.
Yep. Okay, so the next step, if you check a particular statement, give yourself 2 points for that response. Okay, so add up your score. Okay, so if your score is higher than 6 or higher, it is advisable that you need to consult with your physician. Just make an appointment and discuss your risk factors with your primary care physician if you hadn't already done so. This quick self-assessment was taken from the Whole Heart Solution by Joel Kahn. He's an MD, and I pulled that right out the book. Okay, so I found that to be, quite intriguing and relevant to this presentation. Okay, so how does heart disease mimic emotional disorders? Well, it's kind of hard to tell, it's hard to tell, it's hard to know the difference, just looking at a person, okay? Because the three most common conditions, anxiety, panic disorder, and depression, okay? Those are relevant to heart disease as far as emotional disorders that we know about. So when it comes to anxiety, a person may be anxious, they may have a rapid heartbeat or palpitations, having that angina or the tightness in their chest or shortness of breath, because they may be excited about something they have to do different at work, a big exam they have to take, or something major's happening that's really causing them this increased anxiety that they're feeling. Okay, so it's advisable that you kind of monitor that person. You want to treat all the conditions as if it is a cardiac emergency, because you are a lay person for the most part. Most of us are lay people. We're not medically trained, so we have to treat these emotional disorders as if they're a cardiac emergency. Okay, so you definitely want to stay with that person. Don't leave them alone. Monitor them. Call 911 and say, I don't really know what's happening, but I'm seeing something different with my friend that is having some chest pains. Anytime a person is saying they're having chest pains, that is a true medical emergency. Okay, we don't want to play with that. Same thing with panic disorder. The panic disorder mimics heart disease. Okay, so we don't know just from the onset of looking. So we have to be cautious and treat the condition as a cardiac emergency. So panic disorder is really more of an elevated state of anxiety. The person may again have that irregular heartbeat and feeling that I'm doomed, I'm just afraid, I'm just fearful, something bad is about to happen. But they just think it's, brushing it off as if it's a panic disorder, but we may not know, we don't know. So it's always good to treat it as a cardiac emergency. And then finally with depression, when a person's on the flip side, feeling low and feeling sad and want to be isolated, we have to monitor them too, just check them out. If this is something that is unusual or a first time occurrence, we want them to be treated, right? We don't want them to just go on and thinking, well, it's not important. We want to make sure they get the health care services that they need. So people with heart disease may become depressed, which can provide a tremendous impact on their physical and mental well-being. Okay, so with all of that, we're saying, well, what are some beneficial lifestyle changes for a healthy heart? How can I bounce back to living well? How can I have a healthy heart? As we talked about, earlier, getting active. And there's a whole list of things that we can do here to change our, outcomes, right? Our physical outcome. I know for me, I'm talking to myself when we talk about this. So I'm not pointing the finger at anybody, but this is good information for me because I know I need to put it in my own day-to-day lifestyle. I need to make it a lifestyle change and incorporate some of these healthy options because I haven't done everything, right over the years. But now I'm ready and willing to make those positive lifestyle changes so that way I can have more longevity. I'm not ready to go. So it's important that we get active and, taking those brisk walks, running. I mean, I'm not a runner, but I can walk. So anybody have any suggestions as to other ways that you can get active or any things that you all like to do? And you may want to share with the group that what works for you, because you may help somebody else. with what you have to say. So we can open it up. So talk about it. How do you all get active?
Good morning, Deborah. This is Karen.
Hi,
I do the walking indoors when I can't get outdoors or when I don't want to go with
Okay.
Leslie Sanson. She has the walk the pounds away, walk the fat
Yeah.
away, all of that. And it's not difficult and it's fun to me. So I can just pull it up on YouTube wherever I am, whenever I want to do it. And I make it easy. I find, and I do some others, some other activities that I see online, but I have 2 or 3 different programs on my phone that I can just pull up exercise whenever I want. So I try to make it easy for myself.
Great, Karen. Well, I do have that video. So you just, shared, just brought a light bulb back to me. I need to pull that out and you start using
And you
it.
can pick 10 minutes, 20 minutes, 30 minutes, an hour. If I have a goal for 20 minutes 3 times a week or 5 times a week, I can just say, okay, there's my 20 minutes right there.
Absolutely.
Deborah,
that
I just popped that indoor walking link in the chat, so you can check out
Okay.
videos.
Great. Thanks, Becky. Awesome. Anybody else have any suggestions what works for you and how you can help someone else?
Just like to say, don't forget, Alliance has the Zumba,
Mhm.
the yoga. Those are free to staff, obviously. The classes that are offered from the wellness committee, good exercise. I know, like the dance, some of the things I haven't attended those, so I don't know as far as the intensity levels
Mhm.
that some of these exercise programs do. I did, when we were in the office before COVID, I was a diligent participant in the yoga,
Mhm.
and that was really nice. They did it twice a week in the office, and I started doing it at home, but it's a little more difficult because I have wood floors, so it's kind of slippery to sit on a floor, and then you got to haul your computer there so you can watch or do it. But
I get it. Yeah.
yeah, so it's been kind of hard. So I look forward to doing it again. Hopefully, though, once we go back to our normal office setting, that they start doing it again in the office, because I definitely for sure will be doing it again in the office when we get back there.
Great.
So those
Yeah.
even it's not, if you will, cardiac exercise, but it's exercise for stretching. At least you're moving
Right.
your body and you're not sitting at your desk. And
Right.
continuous sitting at your desk is not good for you.
Absolutely. As we saw that in the risk assessment, right? If
Yeah.
you have a desk job, that's not good. You have to get up and move. You really do. Absolutely. So yes, thanks for sharing, Linda. The next point, attaining and keeping a healthy weight. I mean, as we know about the BMI and what's good and what's not good. So I'm sure your physicians have already discussed that with you. But the key point I wanted to make on this segment is that overweight people who lose at least 5 to 10% of their body weight can substantially lower their risk of heart disease. So just losing a few pounds can make a big difference. And again, I do know that to be a testament because it has worked for me and I'm still on the weight loss journey. So yes, so I know it's not easy. It's easier said than done, but consistency is the key. And with anything, we just got to stay on that grind. So if it's something worth doing and we look at the long road, at the end of the tunnel, so to speak, we're going to get there. We're going to get to that point. We may be that turtle, but we're going to gradually get there. And I mean, it just takes effort. So whatever we do to incorporate other people to join in with us, to help us stay on track. I have someone that, likes to go out to eat all the time, but I've told them, I said, look, I can't go to these fast food restaurants. I don't do it. I try to cook at home as much as possible because I know I will stay on track. I know what I'm putting in my food. I don't know what they put in their food when they cook at a restaurant. It's different. So, you have to count all the calories and the carbs, and I'm big on counting the carbs more than calories. So that works better for me. So that's my little spiel on that, how I can get to a healthy weight and stay there. And that's something that I'm looking forward to doing. Eating healthy, as we all know, I mean, this is not new news. We're kind of on that same bandwagon. We talk about it all the time. But what really started me, I mean, you probably say, gosh, you didn't know this. One physician told me that soda is not your friend. I mean, I had to hear it from my physician. And when he said it, I mean, it just stuck. So, and since he said that to me, a couple of years back, I have not drunk soda. And that's not anything I buy, because I don't need all that sugar. And, of course, it's not healthy for me. So, I mean, I just have those little, rewards, that's what's going to get us there to that point of where we want to be. So it's gradual lifestyle changes that we have to make in order to maintain maintain the weight loss and prevent the heart disease from occurring in the first place. Okay. Anybody else, want to chime in and say anything? I welcome your comments for sure.
Well, I can talk more about, some things that I know. Anybody else want to talk instead of me, that's great. But I'm part of a North Carolina program that my aunt invited me to, called Eat Smart, Move More, Prevent Diabetes.
Okay.
And so it's a once a week class, and really it goes on for 18 months. And the first goal is to lose 5% of your body weight.
Okay.
And, as you said, that makes a difference. It does.
It really does.
Every week, in the class, they talk about strategies and skills, how to prevent diabetes, how to lose weight. And these things, the same things that help your heart health.
Absolutely. Now, where's
How
the
to
class,
read
Karen?
labels. It's online.
And I just
okay.
popped that link in the chat as well. Thank you for sharing that, Karen.
Whoa, Becky, you're amazing.
Yes, Becky is awesome. She's on it.
Yeah.
Right.
So and having a buddy is helpful.
Yes.
Because one of the first things we do is establish who's going to be your buddy in the program.
That accountability partner, right?
Accountable to, yes.
Yes.
Who are you going to be accountable to? Who's going to be your walking buddy if you're a walker like you are?
Right. Mm-hmm.
Who's going to be your person who you can go out to eat with? Maybe you both make your lunch and go sit in the park with COVID. It might be a healthier option in more ways than one.
Right.
So that's my comment.
Thank you, Karen, for sharing. Anybody else have any comments? Okay. Well, I'm looking at the time. We're limiting our alcohol consumption, and I mean that's self-explanatory. And we won't have to go deep in that conversation. And of course, being tobacco free, it's important that we abstain from alcohol and tobacco use, because it's just not healthy. It's quite harmful to our bodies. So we want to be aware of that and take action. Managing our stress. We talked about that and ways we can do that. Some folks believe in meditation or the deep breathing exercises, or even just talking to a counselor. Whatever works for you, that's awesome. And even something simple as taking a bubble bath, that's a great stress reliever for me. I enjoy that because that's time for me to be alone and to think about my day, what's coming up next. And that's a part of self-care. So yeah, those activities are just some simple things that we can do to relieve our and manage our stress. Okay, getting plenty of sleep is another area. Well, it's been stated that 7 to 9 hours of sleep is what we need to have in order to feel refreshed. Some people say, well, I can just, operate off 5 hours of sleep or 6 hours of sleep. Well, I mean, if I get at least 7 hours, then I know I've had a good night rest, right? So that is truly important. So in essence, we want to look after our health, go to our doctor's appointments, schedule appointments, don't wait until something excruciating is occurring. Go when you see a first sign of symptom and, talk about it. Don't wait for it to blow up into that big balloon and then it's going to burst. So we want to take action as soon as possible and follow that medical plan or that treatment plan that your physician comes up with for you. When you don't understand, just ask questions. I mean, your physician should be, able to hear and listen to what your concerns are as a patient and, and receive that feedback well. So it's important that, that exchange does take place. Okay. And one more note, if you don't see it on the screen, it should say share a little love. Volunteering for a charity is something that promotes good health. It makes you feel good and you're doing something for others. So, when you have time to help others out, then take advantage of those opportunities. All right. So now we have open mic discussions. Okay, so Linda, you said you want to share a story?
Yeah, I just real quick, I just wanted to share with staff. It's not me, my husband just had open heart surgery.
Oh, wow.
And he had what they call the widowmaker. And the widowmaker is where you don't think anything is wrong with you. You feel fine. You're going on day-to-day life like he was. And he went in for a stress test and it came back positive. And they went to do a stent and they said, we can't do a stent today because you have major blockages everywhere.
Oh, wow.
So in his case, when we went to the doctor's office for the pre-op and all that, they had said that his heart was in excellent condition as far as the muscles concerned, and the ejection fraction was really good and high. The only thing that he's not overweight. He doesn't smoke. He does have high cholesterol and high blood pressure, which is controlled, but his factor, if you will, they have like you had shown a checklist. Mm-hmm. And they have a checklist they go through and they're like, you have everything going for you except he has heart disease in his family. Mm-hmm. So his mother died at 45 from heart disease. So back then, I mean, this is quite a few number of years ago, they didn't have like the technology they do today. So it is really important to be mindful of that. If you have relatives, your parents, anybody, grandparents that had issues like heart disease in your family, to be very knowledgeable of that and be conscientious of your own health, because they said Bob probably would have died this summer.
Oh my gosh.
Yeah, he was 80% blocked in his arteries. And the surgery is very, very, very extensive and brutal. I don't want to, go into details, but it is a very lengthy surgery. They do grafting and to get arteries that bypass the ones that were blocked. So he's doing great, absolutely wonderfully recovering. But it's again, it's one of those things that, you don't know.
Right.
And they had said his factor was they said, we can control everything, the blood pressure, the cholesterol, like you said, those can be treated, but they cannot control genetics.
Right. Family history. It's so
Yep.
important. And,
So
yes, you're so right, Linda. Family history is key. Got to know, and you're asked, what conditions are in your family? Do you have, diabetes? Do you have hypertension? Do you have, all, the list goes on and on. So yes, we got to know who's had it, on what side of your family, on both sides, knowing those statistics, knowing that information, doing that research and asking questions. A lot of time with our elders, They didn't want to talk about their health. They didn't want to talk about, what they were going through, thinking that it's like taboo to talk about health conditions. We need to know, your legacy needs to know, so that way we know what we could be faced with if we don't take action, if we don't, live a healthy lifestyle. So yeah, so I've been preaching that to my family more so than ever before. I need to know the history. I need to know some of these things that I don't know. And you're finding out after the fact, wow, I didn't know, my grandfather had this or my grandmother had this condition. No one ever talked about it. So it's very important. Thank you for sharing, Linda. Anybody else want to share a quick story? Well, if not, I do appreciate that. And I did reference my materials on my slide. I was just going to look at the chat real quick. And I know Becky said she handled everything. Okay. Were there any questions that we didn't cover, or anything that we didn't mention that you want to talk about in the next couple of minutes? Thank you, Becky, for doing a super job. All right. All right. Thank you so much. Anybody have anything else to say? If not, it's been a great group. And I want to say, have a heart healthy day. Thank you all for your participation. This is my contact information. If you need to reach out to me, the best number to call me is on my cell, 910-853-1510, since I'm not in the office every day. But I will definitely call you back. You've been a great group, and I do appreciate it. So again, if you need any information further, you can contact me. All right. Have an awesome day, everyone.
Thank you, Deborah. Great job.